move on to our second case. So in this case, we are handling some pretty sensitive topics, like depression, suicide, things like that. And so if you do feel uncomfortable, then please feel free just to step out, leave the meeting for a little bit, and then rejoin later. We completely understand. All right. So getting into the scenario, here's the case background. So Gracie is a medical student on her GP rotation. She's recently seen a 79-year-old woman, Mrs. James, who came to the clinic after experiencing some issues with her memory. She describes that she frequently forgets doctor's appointments and gets lost when she's in town. During the consultation, Mrs. James was orientated to time and person, but thought that she was somewhere else. She would often lose her train of thought mid-sentence. Gracie is now going to talk to Mrs. James's son, who is Alif, our actor, and take a collateral history. So before we do that, very quickly, what questions might you want to ask this patient, Mrs. James's son, Alif? Gracie, do you have any comments on these very quickly?
Sorry, I just had a bit of lag. Yeah, fantastic. So all good questions. How long has this been going on for? Very good asking the carer how they're feeling about that, especially if they're directly involved in the care of the patient. Yeah, if you keep scrolling, a lot of how long has this been going on for? Does she have any medical problems? Yeah, good. Great. Yeah, so a lot about timescale, but we'll look at some of the other things that you'd want to ask about as well in the scenario. And just to preface this with, we don't expect you to know, the ins and outs of the pathophysiology of dementia, how you would manage it, how specific types of dementia present. What we want you to get an idea about is how dementia can affect people's lives and how you're going to ask questions about that in a sensitive way. Don't expect you to know all of the medical background about it at all. But yeah, we'll look into that when we take the history.
Great. Okay then. So if you want to get started with the scenario then.
Great. Hi, Alif. It's Gracie here. I'm one of the trainee doctors from the GP practice. I don't think we've met before. It's nice to meet you.
Yeah, hi. Yeah, I'm Alif, yeah.
Hi. I was just calling today to speak to you about your mother, Susan James. We saw her in clinic last week to discuss some issues that she was having with her memory. And we wanted to speak to you a little bit today just to get a better idea about how she's been getting on at home. Would that be okay?
Yeah, that'd be good. Yeah, I'm a bit worried about her, so that'd be
sure, of course. Yeah. Of course. So yeah, tell me a little bit about how she's been getting on at home at the moment.
Yeah, well, she's been okay, but she's been gradually getting worse over the last few months. So yeah, like when at home, sometimes when she's talking, like she'll lose her train of thought, or like she'll like kind of drift off, like she's telling me about like TV or the news, and then she'll just like stop talking to me, and she kind of forgets what she was talking about in the last few seconds, which is kind of like scary. Yeah, sometimes like when she'll like forget like what certain things are called, like the phone, or like even some people sometimes, which is kind of weird. I don't really know like how to like deal with this stuff, so it's a bit scary. Yeah, like one of the big things that we were a bit worried about when like it really came to us was like she like was forgetting to go to doctor's appointments, which is like obviously really important, and we're like, yeah, it's happened like 3 times, so it's it's not good. And like I don't, yeah, it's a challenging situation for us, so we don't really know what to do.
Sure. No, I appreciate that. That must be really difficult, of course. Just wanted to ask a few more questions about the memory issues that she's been having. And when did you first notice that she was starting to struggle with remembering things?
I think it was about 2 years ago. I think this was becoming a bit of a problem.
Okay. And was it a gradual thing, or did you notice it suddenly?
I think it was more gradual. I think, because otherwise we would have come into the practice a bit sooner. But it was just over time she's been getting the symptoms a bit more and more.
Sure.
And yeah, as I say, we're just getting a bit more concerned now, just because it's getting worse slowly.
Yeah. At any point in those 2 years, did you feel that there was any point where she suddenly got worse, or gradual throughout those 2 years?
I think, not that I remember, but I'm pretty sure it's just been a gradual thing. There hasn't been a real like jump at any particular point or anything.
Sure. And I just want to kind of recap some of the things that you said, the specific things she was struggling with, just so that I have a good idea of how she's doing. So you said that she's forgetting things in the recent past, forgetting doctor's appointments, forgetting the names of people and objects. Is that right?
Yeah.
Does she struggle with kind of more skill tasks, things that require maybe a bit more planning or like manual dexterity, things like cooking or doing the bills, even brushing teeth, things like that?
So she's pretty good with, like walking around and getting around the house and brushing teeth, and she's pretty good at that stuff. But sometimes she'll, as I say, she'll like forget what she's doing. So maybe if she's in the kitchen like making some toast, she'll forget like halfway through, oh, what am I doing? Which is really, that I think that's something which we're a bit worried about.
Sure.
So yeah, there's no real like her hands up and her like she's be able to move around properly, I think.
Sure. Fine. And I wanted to ask a little bit about, if there's been any incidences where you felt that she's been at risk at home, like even in the kitchen, leaving hobs on, things like that we often worry about with patients, just to make sure that they're safe in the home. Any issues with that at all?
So yeah, that's another reason we're a bit worried, is because stuff like that is something that has happened once or twice. She's just been in the kitchen, just kind of, she's forgotten what she's doing and she's been a bit confused. And yeah, the hob's been on, or like the toaster has been on, or the kettle has been boiling or something. If something's really hot, or there's knives out and stuff. And that's kind of worrying. I don't want it to be like unsafe, like, especially in my care and stuff. So that's something we're a bit worried about.
Sure. And who's she living with at the moment? Is she living on her own or with somebody else?
Yeah, so she was living alone around like 1.5 years ago, 2 years ago. But yeah, as I say, because it's been getting a bit worse, we thought she should live with us, like me and my partner. And
sure.
Yeah, so we can look after her when things are going a bit wrong, just as she's been getting a bit worse.
Mm-hmm. So it's you, your partner, and your mum at home at the moment?
Yeah.
And how's that been working out? Is that arrangement working well for you guys at the moment?
It's okay. It's a mixed bag of stuff, I think, but it's okay for now, but we'll see how it goes.
Sure. No, I understand that it's difficult, and it's a change that you have to kind of constantly get used to. I appreciate that. Sure. I wanted to ask as well, there's the same kind of question about risk. Is there any time that she's ever been in, a dangerous situation you feel in the community when she's been out and about, that you felt a bit worried for her?
Actually, yeah, this has happened as well. Like she's been out shop like to town, and she goes to play bingo sometimes. But one of the times she like, I think she must have been really confused, and so one of our friends, like family friends, had to bring her home, which is quite scary for us because we don't want her to be out doing whatever and just be in a really dangerous situation. So yeah, that's something that has happened, and yeah, that's a real impetus for us to try and see what we can do to try and help.
Sure. And is she still, sometimes when patients have those experiences where they get confused out and about, they sometimes get this fear or uneasiness of experiencing that again. So is she still going out and about in the community and still engaging, or do you find that she's kind of avoiding that a little bit or not able to as much as before?
So yeah, in the past she was really an active member of like the local council. But yeah, as this has become more more of an issue. She's no longer really able to do that. And as you say, like just because of her getting lost in town doing bingo, like I think that's just kind of made her a bit like more weary of doing that. And yeah, I think she's a bit more like, I think obviously she's annoyed, I guess, to an extent that she can't really do what she used to be able to do. So yeah.
Yeah, no, I understand. I appreciate that. It's, as I said, a difficult thing, and it constantly takes kind of adapting to and trying to put things in place to make things kind of suitable for everybody. Before we move on to kind of the things that we might be able to do for your mother and discuss that, I just wanted to ask about a few other signs and symptoms. Sometimes depending on what it is that's causing the memory issues, what the underlying causes, patients might have a few additional issues. So I just wanted to ask if Fiona was struggling with any of those. So any issues at all with her mobility and moving around at the moment?
Yeah, she's pretty good with walking around, I think, actually. So yeah.
Does she use a frame or a stick or nothing at the moment, unaided?
She's able to walk around, yeah, by herself. Yeah,
right.
with no stick or anything.
Fantastic. Any changes you've noticed in the last two-ish years since she started having the memory issues?
I don't think there's been any like weird like behavioral stuff or anything like that. But as I mentioned before, just because she's like less like able to do what she used to be able to do, she's become a bit more irritable around the house, I think, because she just can't go out and do the things, she used to be more independent.
Sure.
Not anymore though.
Yeah, sure. You said she was a bit irritable. How's her mood at the moment? Does she ever complain of feeling low, or how is she feeling at home?
I don't think she's feeling low, actually. I think she's alright, like, yeah, with her mood, I think. Yeah. But yeah, it's just the irritability sometimes.
Sure. Yeah, of course. And just a few other things. Have you noticed any tremor or anything like that?
I don't think so, no. Yeah.
Any kind of slowness of speech or anything like that?
No, not that I've noticed. No.
Any like rigidity of the muscles or just really slow movements? You said her movement was fine. So
no, she's pretty good. Like, yeah, around the kitchen, she's able to, like, when she can like, butter toast and stuff like that. So she's pretty good. Yeah.
Oh, good. And have there ever been any times when you felt that she's acting in ways that are kind of uncharacteristic of her personality, just abnormal behavior? Sometimes you'll find people are kind of uncharacteristically angry or impulsive or things like that. Have you noticed any issues with that at all?
No, I don't think so. Yeah.
Okay, fine. I just wanted to check in case that can sometimes give us a clue about what the underlying cause might be. So I just wanted to ask if there was any other signs and symptoms for her. Does she have any other health conditions at the moment that you know?
Yeah. I think, yeah. So I managed to get, she let me know what's happening with her. And she's got like osteoarthritis, a bit of high blood pressure, and like diabetes. But I think it's all like pretty well controlled the last time I checked. So yeah.
Sure. And I've just got that up on my records as well. And there's been no new issues in the last couple of years, and she's been doing well on her medication. So nothing that I'm worried about in that respect. Fine. Okay. Before we kind of discuss what we want to do moving forward, is there any other kind of questions or queries that you had that you wanted to ask me, or anything that you would like from me specifically that you think would be of benefit to you guys? Yeah,
I just want to know what we can do, so I just want like what like kind of treatment stuff we could like get like do to help her with her memory, or just stuff to make her more safe, or maybe even make her more independent, just anything down that road.
Sure. And I completely understand it's difficult seeing your parents in that way. It's a difficult thing to experience for sure. Of course, let's talk about that then. So the first thing that I want to do is refer your mum to a memory clinic. So that's a more specialist clinic, and what they can do is they can assess her memory more comprehensively. So they'll do a kind of long questionnaire with her to find out exactly which aspects of her memory are affected and in what way. And they'll do some blood tests as well, and maybe some scans, and they'll be able to tell you what the kind of underlying cause behind her memory problems might be. Okay. Once they have that information, and they can let you, let you know about that and give you maybe a more definitive diagnosis, they can tell you what the best way is to manage that. So whether there's any medication that might be useful for her, whether there's any therapies that might be useful. But it's really important before that we do a full workup. And we find out exactly what might be going on. So I'm going to make a referral for you for them, and they'll contact you directly. And once you've seen them, we can touch base as well and see how everything's going on.
Okay. Yeah.
In terms of things that you might find beneficial, just day to day in the home, sometimes patients with memory issues can get disorientated, and they kind of might not know where they are or what time of day it is, what year it is. As you said, forgetting people and just getting confused and disorientated. So something that can often help patients is writing somewhere in the house really clearly what day it is, what date it is, what year it is, and having a day and night clock to show them exactly what time of day it is.
Okay.
It just means that they're more orientated and they know where they are. And that can just help them feel a little bit more secure. Other things is to kind of try and engage them in activity. So not letting them be too passive, keeping them kind of sharp, doing little things. And that will also help to keep them engaged and happy and do the things that they find fulfilling. You said that your mum liked to go out and about and she's kind of able to engage less. So I wonder whether day centres, which are kind of more supervised and safer, might be a better option as well. So I'm going to leave you some links for those and you guys can see whichever is the best fit for you. Okay. If you ever find she's finding it difficult to take medication and things, you can ask your pharmacy to make a dosset box. So, individual boxes for each day of the week with her pills in it, and they're labelled. So it's a nice cue to take medication, and you can see which medication's been missed really easily. So those are some of the things that might help. Is that okay? Does that sound good?
Yeah, that definitely sounds helpful.
So what I'm going to do is I'm going to leave you with the links and the information that we spoke about, make your referral, and we'll catch up in a couple of weeks to see how everything's going. And if at any point you feel that things are getting worse or you want to come back and see us, please just pop back in. Okay.
Okay. Thank you.
Lovely. Cheers, Leaf.
Right.
All right then. That was great. Very quickly, what skills did Gracie demonstrate? Yeah, lots of good stuff. There were some people in the chat saying they wished their GPs were like you as well, Gracie. So great stuff. I think we'll just go to the explanation slide, please, Kat, and Gracie, you can just talk through.
Sure. So as I said, guys, don't want you to leave this thinking, oh, I need to learn everything about dementia and how it presents, how I'd manage it, what I'm going to do for this patient. But it's about understanding, how is that going to affect people's life, and how are those memory issues going to affect their functionality. So, of course, you might be in a position to give medication and give therapies, but you need to be looking at it from the perspective of, is that patient, able to do the things that keeps them fulfilled, that keeps them happy, that keeps them healthy, and means that they have a good quality of life? Are they able to go out in the community and do the things they enjoy? Are they able to see the people that they want to meet? Do they have good support at home? Do they have good relationships with the people that they're living with? And do they have good care? If they don't have those things, then how can you try and provide that? So that would be things like contacting the local council for a package of care, so that somebody can come in and help that family to meet the needs of whoever it is that is struggling at that time. One of the kind of key learning points from this as well is that it can be really difficult to take a history from some patients. In this case, it's because the patient has dementia, and of course they might have some issues remembering times when they've been in a potentially dangerous situation or in an at-risk situation. They might not remember times when, you know, their plans have been impacted by their memory. They might not be orientated to time, place, or person, so they might not know where they are. They might not know what day it is, what date it is. They might not remember you from a previous consultation. Patients with dementia as well, sometimes you'll notice that you'll ask them a question, they'll start to drift off in the middle of their answer, and they'll lose their train of thought. You'll find it quite difficult to pick the conversation back up. So it can be difficult to tease information out of them. And some patients might not have good insight. They might not think that they have a memory problem, especially if it's maybe a milder issue. And so it'll really be their kind of carers, friends and family that are noticing those issues before the patient is. So it's really important to realize, when am I not getting all of the information from the patient? When do I need to try and get a collateral history from carers, family, from their, you know, social care worker, so that I really know that patient and what they need, and so that I'm in a position to fill those gaps for them. Let's have a quick think as well about the kind of types of questions that we asked. Again, don't expect you to know about the types of dementia, but we asked about some additional symptoms. So mobility issues, the tremor, the slowness of speech, the muscle rigidity, because in some types of dementia, you can get types of Parkinsonism. Again, don't worry too much about this, but it's an awareness that it can exist with other things. We always ask about the patient's mood. With any chronic progressive condition, it's always important to see, how is that patient feeling? How is that, you know, condition affecting their self-image or their relationships? And how is it affecting their mood at the end of the day? And a really important thing here as well is that severe depression can mimic dementia. It can make patients have poor concentration, be forgetful, be really withdrawn. And so it's important to be able to differentiate between those two. Is there an underlying mood issue? So that's, you know, just, again, you don't need to know all the minutiae of these things, but to have an awareness of the types of things you want to ask about. We also asked about personality changes or abnormal behavior, because sometimes patients will start acting in really bizarre ways because of the underlying pathology of that's causing their memory issues. And that can often be quite distressing for carers and for the patient as well. So really important to have just to have an understanding of that. And again, you know, the main thing in this case was to understand the patient's living situation. Was she ever at risk? Who is she living with? Is she having the care that she needs? Is she able to get out and about and live her life in the way that she wants to? The management things moving forward, that's something that you learn in medical school, so it's nothing to really worry about, but important to address the son's kind of thoughts and feelings here. What is it that they would want? What help and support are they seeking? You know, he wanted some little things that they can do in the home to feel like they're helping and to keep their mum orientated. So always important to ask those about those things. Again, ideas, concerns, and expectations for every single patient or patient's family in this case that you're speaking to. Yeah, just in the interest of time, happy to leave it there and move to the next one. But if anyone has anything to add, of course, feel free to.
I think we'll move straight on to the next part of the scenario, and then if there's some time at the end, we can take a few questions.
Sure.
So yeah, so this is the second part of the scenario. Here we are discussing some sensitive topics, again, mental health, things like that. So if you do feel that you need to step out at any time, please feel free to do so. So Gracie again is a final year medical student. It's the same thing. And she's been asked to see Alif, who's caring for his elderly mother from the scenario before. And this is 3 weeks later. And Alif has come to see Gracie because he's feeling increasingly stressed, and he feels that he can no longer cope with his responsibilities of caring for his mother. So I think we're going to do the Menti very quickly. Kat, if you could go to the next slide. What questions would you like to ask this patient? We'll just, like, you guys can enter your answers. We'll just take a quick look and then move straight on.
Yep, very good suggestions. How are you feeling? Important to understand, yeah, get a really good grip of specifically what it is the patient's experiencing. Yeah, asking about the mother, has her condition worsened and how that's affecting Elif. Yep, any changes, any specific things that are worrying you. Yeah, very good, very good. And there's lots of different things to ask about with mental health and low mood or anxiety. So we'll cover those because it has a really kind of broad impact on people's lives. Just to reiterate again what Shrey said, like we will be discussing kind of suicidality and yeah, self-harm, suicide. So if that's something that is a sensitive topic for you for whatever reason, then please do feel free to just mute us, come back for the discussion at the end. That's absolutely fine, whatever works for you guys.
Great. All right then. So if you guys want to get started.
Hi Elif, it's Gracie here. I'm one of the trainee doctors from the GP practice. Nice to see you again.
Yeah, hi, how are you?
I'm good. How are you doing?
Well, I mean, as you know, I've been caring for my mum, and I don't know. I feel like I've not been very good at doing it, which is making me kind of sad, like kind of unhappy, like kind of making me feel a bit low. Yeah.
Oh, I'm sorry to hear that. I'm sorry you've been feeling like that. How long would you say that you've been feeling low for?
Well, it's been probably like the last 6 months. Yeah, since my mum's been getting a bit worse.
Okay,
Yeah.
I'm sorry about that. Feeling low can look like different things for different people. And I just want to get an idea of what it looks like for you. So when you're feeling low, kind of how do you behave? What does it look like for you?
Well, I don't know. I find it hard to like concentrate on things, I guess, sometimes. And like if I'm watching TV or like reading or something, I can't. Yeah, sometimes I end up just kind of losing my train of thought, being a bit like, yeah, I don't really know what, like just losing my train of thought basically.
Yeah. And how's your motivation and your energy to do things? Do you feel that you're able to get up and do the things that you like, your commitments that you have?
Well, I mean, I have to care for my mum, right? So yeah, like that keeps me, getting up in the mornings and stuff. But yeah, so sometimes like sometimes I don't eat as much maybe as I should, so I can't really be bothered to cook. But yeah.
Okay. And you said about your eating, is it that you don't have the motivation and the energy to go and get something to eat, or is it something else that's stopping you from eating?
Yeah, I just basically like can't be bothered to cook sometimes because it's a lot of effort, I think.
Yeah. Sure. How's your sleep at the moment?
I mean, it's not great, to be honest.
Yeah.
Sometimes I try to go to sleep, but I end up just like worrying loads and not actually going to sleep, and it takes me ages to go to sleep, which is not fun.
Yeah, I'm sorry about that. And the thing is, all of these little things, the eating and sleeping, can then make your mood even worse, can't they? Because they have such an impact on how you spend your days. Just to ask about your sleep as well, do you ever find that you wake up in the middle of the night, or that you're waking up much earlier in the morning at all?
Yeah, I can sometimes, yeah, even if I go to sleep late, I end up sometimes waking up like way earlier than I thought I would. Yeah, I just wake up like 7 o'clock randomly. It's like, yeah, it's quite annoying.
Sure. Okay. And you said that looking after your mother was taking quite a toll on you. Is that right?
Yeah, it is. Yeah. Because she's just getting worse and worse. Sometimes I'm like, like I just feel like I'm not able to like actually look after her properly.
Yeah.
And yeah.
Yeah. Fine. And other than looking after your mother at the moment, just to get an idea about the kind of different aspects of your life and what might be affecting you, is there anything else that's bothering you at the moment other than your care responsibilities?
Well, a little bit. So like my partner like split up with me like 6 months ago, which was quite hard
Yeah.
for me. Yeah.
I'm sorry to hear about that. I'm so sorry about you and your partner. Um, do you feel after that that you have good support at home at the moment with other family members or friends, especially after breaking up with your partner?
Well, because I have to take care of my mum, I often don't just get the time to like find time to meet up with my friends. And yeah, my kids they try to help, but like they live far away, so they don't, you know, it's all hard. They have like their own lives as well, so they have to. It's hard to schedule it all properly, you know.
Yeah. So you're finding it hard at the moment to kind of get a break from looking after Fiona, is that right?
Yeah, it is. Yeah.
Yeah. I'm sorry about that. I'm sorry. I understand that's difficult. And do you have any additional help with that at all, with any other family members or any additional help that you get to care for your mum?
Yeah, not really. Like that. Yeah, not really. Yeah.
Okay, fine. And I just wanted to ask, Leaf, I know it's not a pleasant thing to speak about, but I just wanted to ask whether, you know, you've ever felt so low that you've thought that you didn't want to be around anymore, and that you've had, you know, any thoughts about harming yourself in any way?
Um. Yeah, when I'm really like feeling really like low, I sometimes I'll feel like I don't want to like live anymore, just because I just feel like I'm like not actually helping my mum, you know. Yeah.
I'm sorry that you're feeling like that. Can I ask, is it a passive thought of not wanting to be here, or do you think that you'd ever act on those thoughts?
I think it's a passive thing, because like obviously if I were to die, like my mum wouldn't have anyone to care for her, you know. So that means I just feel like I have to do it, stay, you know, keep going, just because of her. Yeah.
Yeah. And you've not made any plans to act on those thoughts, either in the past or now?
No, no.
Okay. Okay. And you said that it was, you know, looking after your mother is something that maybe stops you from acting on that. Is that right?
Yeah.
Okay. And if you ever did feel, you know, acutely in that moment that you were not able to manage those feelings, and that you felt that you're a risk to yourself, do you know who you would turn to or where you would go for the help that you needed in that moment?
Yeah. I have some friends I'd probably call if I was feeling really bad.
Sure. Okay.
You know. So
And I just want to let you know as well that you can, if you're feeling, you know, really awful in that moment, you can always go to A&E. You're always welcome to come back and see us with our walk-in service. So please come back and see us if you're feeling worse. And there's also helplines that are open 24 hours a day. And sometimes, you know, in that moment when you're experiencing quite difficult emotions, it's just useful to talk through them with somebody. I'm going to write those helplines down for you, just in case you ever do need to use them. They're there for you. Does that sound okay?
yeah, that sounds like a good idea. Yeah.
Good. And Alif, have you ever had any other mental health issues in the past?
Like I think 4 or 5 years ago, me and my partner had some problems in our relationship.
Mm-hmm.
So that made me quite sad, quite a bit depressed. Like they said, it was a bit of depression apparently.
Yeah.
So because of that, I went to the GP, and they said to do some like CBT, I think it's called.
Yes.
And that was good. I think after we did it for a few weeks, and it was helpful. Yeah.
I'm glad that was helpful for you. I'm glad that was helpful. So since you know, you said 4 or 5 years ago, that kind of episode of feeling low, had the CBT helped. So since then to now, in that interim period, how had you been feeling in that time?
I mean, I think after that, like we kind of got a handle on things, and it was pretty fine, and like it was a good. It was fine after that, I think, for the last like 3 years. But then, yeah, because of mum, I've had some. Yeah, my partner, like left. So yeah.
Okay, I understand. Sure. I just wanted to ask some general questions as well, just to make sure that I haven't missed anything. Any other health conditions, Elif, that you have?
No, I don't think so. No.
Any medications that you take regularly?
No.
Okay. And do you drink at all?
A little bit, like not too much, like a bit of wine, like wine in the evening sometimes. Yeah.
How often would you say that you, if you had to kind of quantify it for me, just so that I know?
Like maybe like 2 or 3 times like a week, like in the evening.
How much would you be having 2 or 3 times?
Like I guess like 1 or 2 glasses. Yeah.
Okay. Do you smoke at all in the past or currently?
I used to a bit at university, but not anymore.
Okay.
Yeah.
And any recreational drugs at all?
No.
Okay. And Elif, sometimes, when people are feeling low or they have difficult emotions, they find themselves drinking a little bit more or smoking a little bit more because it kind of takes the edge off for them and it makes that feeling a little bit more bearable. Do you ever find that that's an issue for yourself, or that's not something that bothers you?
I don't think so. Maybe I drink a bit more wine than I did a year ago, but like it's not that bad really.
But it's not. Okay, sure, that's fine. Okay, so you've done the right thing to come in and see us and to get a little bit of help and support. I have a few things that I think might be beneficial for you, but before we talked about those, I wanted to ask you if there's anything that you think would benefit you or that you wanted to ask me about.
Yeah, well, I mean, I think it'd be good, like, if there's anything like we can do to help my mum with like getting support in the house, that would be really good. I think that, but other than that, I'm not really sure.
Sure. Okay. I think, of course, I think that will be a really beneficial thing for you, to give you that little bit of time to yourself, where you can do the things that you find fulfilling and that you enjoy, and to kind of replenish you so that you can go back and care for your mum. I think there are some local charities who run day centres. So places like Age UK, Alzheimer's UK, and that's kind of a safe, supervised environment where your mum can go for short periods of time, and it gives you a little bit of time to yourself and a bit of a break, a bit of respite. I'm going to write the links for both of those down for you. You can contact them directly and ask to arrange sessions with them. The second thing that I think you might find useful are some carer support groups. They provide kind of talking therapies or group talking therapies with fellow carers. And they can provide some respite as well, some breaks away, or, even for shorter periods of time, a little bit of break for you. So I'm going to write the link for those down as well. And again, you can contact them independently and see which one is a good fit for you. I want to try those things first. If we feel that that's not getting on top of things, we can also contact the local council and think about organising a package of care. So that would be somebody coming in and helping look after your mum. Again, I want to try the first 2 things, see what impact that has, and then we can escalate it. And I just want to ask, related to that, are you working at the moment?
So I used to work a lot more, but because of the time commitment of caring for my mum, it means that I can't really work as much as I used to.
Sure. Okay, yeah. I understand. And so, if your kind of work commitments change as well and you feel that you're available less, then we can think about that package of care as well. So come back to us if that situation changes as well. So let's try those things. The second thing that I think will be useful is maybe trying another course of CBT. You said the last one was useful. We can try CBT or another talking therapy. They can assess to see which one will be useful for you. People often find that tremendously useful to kind of talk through the difficult emotions that they're feeling in that moment. How do you feel about that?
Yeah, I guess, yeah, because it worked last time, I guess you may as well have another go.
Sure.
Yeah.
Okay. I'm going to leave the link for that with you as well, and some information about the service, and you can contact them directly, again, self-refer. I want to try the CBT first. If we feel that that's not getting on top of things and that things are getting harder for you rather than getting easier, then we can think about medication. Okay. So, antidepressants or SSRIs is the kind of class of drug. They're not going to fix the underlying reasons behind your low mood, but they might make things a little bit lighter for you. So they might be able to kind of improve your motivation and your energy, and improve your appetite and your sleep, and make things a little bit easier for you to make the kind of positive decisions to make you feel better, and to change the situation that might be causing you to feel low. What are your thoughts about that? Because some people really kind of don't want to take medication, others are much more open to it.
Yeah, I mean, yeah, I guess I'm looking for things that work, so I mean, we can try it, and I guess, like, if it works, and if it doesn't, we can not do it.
Sure.
Yeah.
So what I want to do is I want to try the CBT first. I'm going to give you some leaflets about the medication, just so that you're clued up and you have kind of a good information base moving forward. I want to touch base with you again in maybe 3 weeks' time to see how you're getting on. And we can review what's been helping and if you need any additional support. And if at any point you feel that you're getting worse and that things are becoming harder for you, and it's getting to a point where you can't manage, you can't cope, please just come back and see us, okay?
Okay, yeah.
I'll see you soon. Thank you, Alif.
Okay. Bye.
Great. Okay, thank you so much, guys. So I think we don't have too much time, but very quickly, what skills did Gracie demonstrate? All right, all good stuff. Gracie, if you want to just very quickly go through the stuff.
Good. I'll just have a quick run through. When do you guys finish, just so I know?
2:30.
2:30. Okay, quick 5-minute summary of this station. Also, thank you, Alif, for acting. You're fantastic. So thank you for acting out both stations. So firstly, again, don't expect you guys to know the minutiae of the pathophysiology of depression, how to manage it, but to understand the ways in which depression can affect people's lives, and types of conversations that you'll be having with patients and how to have those sensitively, because these are potentially going to be some of the most difficult times in patients' lives, and you're kind of there to help and support them in the best way that you can. So firstly, I'm sure you guys know, but just to preface this, is that to always take the patient seriously, because depression is not just feeling sad for a period of time, as some people think. Sadness is something that you can almost compartmentalize and forget for a period of time and carry on doing what it is that you have to do. And depression is a much more pervasive deflation of your mood that affects the way in which you do things, and your ability to actually be functional and enjoy your life. It affects so many different kind of aspects of people's lives, as kind of Alif showed in this scenario. So it can affect your appetite, your sleep, your concentration. Often patients will kind of describe watching TV or reading a book and just not being able to focus at all, just kind of losing themselves and their thoughts, essentially. The other thing is that patients can often have these kind of negative thought spirals about, feelings of guilt, feelings of worthlessness, low self-esteem, or just hopelessness for the future. So it's important to kind of tease out what is their actual thought process that's causing them to feel low. The core things always to remember is that depression is about low mood and not enjoying anhedonia, so not enjoying the things that you would otherwise have enjoyed, and having low motivation and energy to do things. So classically, patients will often speak about just kind of lying in bed and not having the motivation to get up and go to work, make themselves something to eat, see their friends and things like that. It's really important to understand the patient's kind of life situation. So in this case, the carer responsibility that Elif had, also personal relationships, your relationships with your friends and family, stresses at work, financial stresses, anything like that, that might be really taking a toll on the patient. So try and tease out their life situation of things that are causing them difficulty. And just listen to them talk about them openly, the things that are, causing them to feel low. Another kind of important thing in this scenario is talking about risk and risk assessing a patient. So having that really difficult discussion about suicidality. It's always a really difficult topic to bring up. But it's really important that you do for essentially every patient who comes in with low mood. It's really important to are they acutely at risk of harm? So just asking them, have you ever felt so low that you've wanted to end your life or harm yourself in any way? And I think it's important to understand that, unfortunately, a lot of people will have these fleeting suicidal thoughts at some point in their life, these passive thoughts of not wanting to be here. But it's important to differentiate between that passive fleeting thought and an active thought. So does the patient actually want to act on that feeling of wanting to end their life? Have they made any plans? Have they written a note? Have they tried to tie up loose ends? Because that for us is a higher risk individual that we want a safety net. Important to ask the patient, what is it that stops you from acting on those thoughts? Highlighting those protective factors and having an understanding for those. And the last thing, always safety net the patient and let them know if you're ever feeling acutely really terrible, what is it that they would do and where is it that we would advise that they would go. So letting them know about A&E, coming to your walk-in service, about Samaritans or Nightline, and just make sure that they're safe. That's the one thing that you absolutely have to make sure that you do is make sure that you're safe and you've risk assessed that patient. I could go on, but it's 2:30, so I don't want to take too much of your time. And I just want to say, guys, thank you for coming. Firstly, so many of you. There's so many of you. It's Saturday. I would not be here when I was applying. And just a quick message to say that, I know that when you're applying for medicine and things, it often seems like the be all and end all, and it's like a rat race trying to get things for your portfolio and do things. But just remember to do it for the right reasons. Enjoy your life. Enjoy everything else in your life that you like doing. Medicine is not everything, and do things for the right reason. There's no point being too competitive or getting caught up in a rat race. Just enjoy what it is you're doing. Learn for the sake of learning those things, and yeah, just relax, because medics stress really easily, and they're so caught up in medicine and these just these kind of so much work. So yeah, just relax and enjoy life, basically.